Hello, everyone. Thank you for joining us for another edition of Career Cloud by Give Specific. Today, we are joined by Sheveeta King. Hi, Sheveeta. How are you doing?
Hello, Augina. I'm good. How are you?
I'm very good. It's so good to see you.
Yes, very.
Yes. Sheveeta and I have been friends for around 8 years. We met through our husbands. We were in each other's weddings. And we just had a good connection, and here we are interviewing.
Long time.
All right. So first, I'll start by reading Sheveeta's bio so you can get some background information, and then we'll jump into some questions.
Okay, sounds good.
All right. Sheveeta was born and raised in Atlanta, Georgia. She is the second oldest of 6 children and is very family-oriented, especially since her whole family lives in Georgia. Sheveeta grew up as the daughter of the family's first college graduate. Her mother participated in and introduced her to many organizations, including 100 Black Women. Helping her mother and being one of the oldest children developed her passion for helping others. Following in her mother's footsteps, she graduated from Georgia Southern University with a bachelor's in nursing. During her time volunteering and working as a patient care tech in college, Sheveeta's dream was to work in women's health. Dreams do come true. After graduating, Sheveeta worked as a postpartum RN. After a few years, she decided to pursue both her loves, nursing and travel.
Yeah.
Becoming a travel nurse, she was able to see many different places and meet new people. Soon, life took her to Jacksonville, Florida, where she was able to expand her women's health knowledge in labor and delivery. Sheveeta lives in Honolulu, Hawaii with her husband and their puppy, Jax. She is currently working in a well-renowned hospital in the Pacific for women and children. She soon hopes to start her master's degree for an advanced practice registered nurse.
Yes.
So, could you please tell us about how you chose this career path and what led you to the position you're in right now?
Sure, yes. Well, there were many things that led to this position as far as my desire for women's health. However, I would say my biggest factor would be my mother and the organization she helped me go into. One particular was as a young child, she helped me, or rather introduced me to an organization in Atlanta that was called 100 Black Women of Atlanta. And that organization did a lot in the community, especially with the Black community, specifically with the AIDS community in Atlanta. And so it gave me a different scope, especially as a child, when you don't have to do those things on your breaks and so forth to be able to help others. And so doing that, I feel like that paved the path for me. And then also growing up, being a second oldest of 6, I was like, a second mom a lot of times, as well as helping my mom when she would go through things as, during my childhood, not necessarily taking care of my brothers and sisters as their babies because we're so close in age, but helping her with surgeries and so forth. And so that really basically made me make sure that I wasn't sick when I saw blood or anything like that. So it enticed me to learn more about it. And when I was younger too, I found out that my grandmother was also in the medical field. Actually, both my grandmothers were. So it was kind of like a little bit of a legacy as well. And so that just made me go into that direction. But like I said before, working with my mother, it intrigued me more to find out things about women, just because, being a woman and becoming a woman, you wanted to know more. And I found those things very interesting. So I guess learning something about yourself was really my path. And that's where I learned. That's why I chose it.
Okay. I heard you say that you like being with your mom in different organizations and helping her after like recovery from her surgeries. I know that's one of the characteristics being helpful is, big in being in healthcare. So
Yes.
what are some other attributes or characteristics that you would say are essential to be successful in the healthcare industry?
Definitely patience. Patience is the key skill to have. And on many levels, patience with yourself to learn a new skill. As far as being in medical field, people think that it's about putting a Band-Aid on, and it's not. You have to learn about the person physically as well as mentally. And that goes for yourself because you don't know your limitations. And so having that patience along with empathy and sympathy for those that are coming into whichever facility you're working in for your help are big, big factors. It'll take you far. Sometimes when a person's having some of the worst days and they're coming into the hospital, your smile and your empathetic nature can make it one of the best days at the same time. So I think it makes a lot of sense.
It makes a lot of sense. And I'm laughing because you said smile. Mm-hmm. Because I know, I know you're a labor and delivery nurse, and you were actually in the room with me when I delivered my first child. Yes. And I was thinking, you have to be nice and friendly to be in that profession, because if I'm coming in and I'm in pain and I'm having contractions, I want you to be smiling and happy, because I'm not happy right now. I'm in pain. So I think that's a very good characteristic to have in the profession. So what's a typical day like for you? What does it look like to walk in your shoes?
A typical day, I would go to work knowing for a fact that I would be there for 12 hours. Most nurses in hospitals, particularly as, like I said, a labor and delivery nurse, our offices and buildings don't close because babies and sickness does not stop. So it's 7 days a week. And so we have a 36-hour week. And usually at the start of a 12-hour shift, you are going to relieve that first nurse that was there. The key to starting a good day is to have that good rapport between each other as far as reporting the things that happen for your patient and everything else, as far as like her sickness, her mental status, what's going on with her, like who's checked on her, knowing what type of resources you have, as far as like if she needs social services or, a little help here and there. It's about a good team, basically. And so then you get to meet your patient. This signifies being able to have that relationship continue from one nurse to another, from patient to patient, just because that patient then understands that, oh, I'm leaving you in good hands. So after that, an assessment of the patient to make sure she's good and making sure that you understand what type of status she's in. And then in my field, it's a lot of waiting because the baby comes when it wants to. As much as we all want baby to come right now. However, it can be a wait and see game. But that's the part where I said that empathetic nature and the patience is big and key. And usually, if I'm lucky, I get a baby by the end of my shift, or maybe a few sometimes when things are really wild. And you get to share that joy and bring new life in with these new parents or, returning parents. And then we go home. So it is a bit of a hustle and bustle sometimes, and other times it's nice and easy. So it just depends. Babies don't really give you a manual on how they're gonna do anything.
True. I know that from experience. It's very true. So could you tell us, since our viewers would like to know more about your field, what you do on a daily, what kind of decisions do you make on a daily basis? What kind of things are in your hands?
Okay. Well, basically, as a nurse and a registered nurse, my decisions are based as far as in a team aspect, because I work very closely with a nurse that's overcharged of the whole unit. And you also have partners in your unit as well as doctors. And so the doctor and the nurse relationship is very, very important, because you guys set up things for this patient. The doctor normally does not come in and stay like I do at the bedside. The doctor sees several patients, and I'm there personally for you. So I'm there to advocate for the patient. And if she decides she doesn't want this, you know, we'll go through these decisions where I explain things to her, make sure she's comfortable. And if she's still not comfortable and she needs somebody else to help, then I go to the doctor. But other than that, as far as other decisions, it's based on experience as well as textbook. Textbooks can be, okay, if this happens with your blood pressure, okay, this might have happened. But over time, the experience comes where, you know, if a baby doesn't do well here, then you know you have to do that. It's almost like you can't learn that type of thing. You have to experience it through life. And so quick decisions, particularly life-saving decisions, sometimes can be very hard, but very overwhelming and accomplishing feeling. Because at the end of it, when you have a healthy mama and a healthy baby, that's all that matters. And as long as you do have that team of other nurses, of nurse aides, and of the doctors, it's amazing.
That's nice.
Mm-hmm.
So I do have a question, because I know in your bio, you said that you had experience with travel nursing.
Yes.
So could you share with us what that experience was like and what you learned and how everything went?
Yes. So travel nursing was one of the best things I think I've ever done with my career. It basically got me ready for the end of my career, or my current career rather, just because being in Hawaii, things are very different than what we call the mainland of the United States. It's different cultures and so forth. So growing up in the South, I decided that I needed to broaden my scope and see other places, because I love travel as well. And I decided to go and do what I love nursing wise and do it elsewhere. Being able to pick an agency and have them give you great benefits, as well as, you know, almost like leaving the nest, so forth, I guess, because everybody goes to college and so forth, but it doesn't feel like you've actually left. It's not like, oh, I went to college a few hours away. No, you went across country. So it was definitely exciting, and it gave me the opportunity to make sure that you as a person and as an adult, you were able to go and basically cover yourself with a whole new type of culture and way of life. Myself, I went to New York and basically was able to see a totally different culture. I had never been introduced to a Jewish population in that capacity, and it really opened my eyes to all these other different, you know, cultures on a personal level. It's like you learn about them in nursing school because you have to have that diversity, but to be able to see that helped me a lot. So like I said, it's one of the best things I've ever done. And I encourage everyone to be able to try to have that type of experience, because it allowed you to just open up and blossom as a person.
So are there any other certifications you need in order to be a travel nurse, or is being an RN enough?
You do not have to just specifically be an RN to be a travel person. At first, I thought that's exactly what it had to be, because that's just like all they speak of is RNs. But you can be travel surge techs, you can be travel medical assistants, that things like that are available. and you don't have to be an RN with a BSN or anything of that nature as far as your bachelor's go. You do have to have experience, however, because coming in as a travel nurse, your job is to be able to come in and relieve, not necessarily if somebody's on break or what have you, but you're supposed to go in knowing exactly what you need to do. You should be able to be oriented to a unit, and then they let you go. And so it's not like training you as a whole new nurse, basically, which was very nice too, just because it gave you, as a nurse, you learn one thing initially at your first hospital, and then you go to this different hospital with experience already under your belt, but you learn even more. So it just broadens your scope as a nurse and as a person here.
I think that since you've had so much experience, you've had experience as a travel nurse as well as a labor and delivery nurse, I think there's a lot of, you could really give us some advice to those who are thinking about pursuing a career in nursing. Do you have any advice for those viewers?
Yes, actually. I believe that if anyone has a desire to go into the medical field, particularly nursing, I know a lot of people think that nursing is specifically all about money, and it does make great money. I do love my profession for that, but at the same time, I feel like if you go into it with just that, it can be probably a setback. So if you're going to go into that type of profession, volunteering and seeing yourself in those fields first can be very helpful. Seeing if you're going in there for yourself, and if you're a person who likes to take care of others as far as helping them, and not necessarily just being a crutch for someone. You're actually being there to support somebody and lift someone up and make them better as people, or mentally and physically. I think that would be a great person to go in that type of field. So basically just making sure you are good in your heart, and knowing that you're going in this for a right reason would be great.
I think that's some very good advice, Sheveeta. I would like to thank you so much for joining us today. Thank you for devoting your time and being so committed to this vision that we have, being able to freely give yourself and information. So thank you for that. We appreciate you.
Yeah. Oh, no, I appreciate you guys. I think this is a great organization, and anybody willing to come a nurse, you should do it. It's very, very enjoyable and accomplishing as a person. So I think it's great.
Good. Thank you. So to all of our viewers, we want to thank you for watching. We want to ask that you follow us and subscribe on Instagram, Facebook, as well as YouTube. We also ask that if you're able to donate to Give Specific, you can do this on PayPal as well as patreon.com. This is to help the program going, help keep new faces and new professions coming to share their stories with you. I also want to encourage you all to come back for the next video. We do have a lot in store. We have a lot of professions coming, a lot of professionals coming to share with you how they got to where they are, how you can get to where they are. And it only takes work. If you put in the work, you can have it all. So we want to thank you again for joining us. And Sheveeta, thank you so much.
Thank you.
Have a good day.
You too. Bye.
Bye. Thank you.